Now, the Electoral Commission says it has already begun implementing the directive of an Accra High Court. Now, we'll get more on that story in just a few minutes. But before that, Ohiming Teria, he witnessed that news conference live. Ohiming, very worrying statistics that Dr. Tinkorang put out there. Give us a bit more detail of what the director said.
Yes, Daniel, what is more worrying is the fact that many people in Ashanti region are not adhering to protocols as announced by Ghana Health Service, especially on the wearing of face masks, adhering to social distancing, and also people paying so much attention to their health. So Dr. Tinkorang says it's a worry. And if you compare to the other information that he gave, now with a 207 isolation center, bed isolation center in the Ashanti region, 156 people are on admission. And if you look at the treatment center, the one at the Kumasi South Hospital, Konfanoche Teaching Hospital, they are all full. It's being occupied by COVID-19 patients. So he says, whilst efforts have been made to expand the treatment center, there's also the need for people in Ashanti region to adhere to social distancing and also practice hand washing. He mentioned in particular, gone are the days where you see people in Ashanti region washing their hands from Veronica buckets, but this Veronica buckets are mixing in Ashanti region. And he says if people continue to disregard or blatantly disregard social distancing protocol, wearing of face mask, and also hand washing protocols, then it will go a long way to increase the number of cases that we have in Ashanti region and also increase the number of COVID-19 related fatalities in the region. Currently, 2,403 people have tested positive for COVID-19, and the region has also recorded 38 deaths. And the concern is that most of the people who have died are not showing signs and symptoms of COVID-19. Daniel.
Right. Ohiming, did Dr. Tinkorang specify what efforts are being made to expand the capacity of these isolation and treatment centers?
Yes, he did mention that with regard to isolation center, the Regional Health Directorate have secured the Ghana National Association of Nurses, their hostel in Ejeso, to be used as an isolation center. Now, he also mentioned the fact that the Kumasi South Hospital Treatment Center is being expanded from 20-bed capacity to 40. And then the Konfanoche Teaching Hospital's one is also being expanded. And a doctor in Kumasi has also promised to release a facility to be used as a treatment center. So the Health Directorate in all is looking at expanding the treatment center from the current 48 to 138 in Ashanti region, Daniel.
So, Ohiming, we know that because of the challenge with getting patients into isolation centers, some COVID-19 positive patients were kept in wards with patients who don't have COVID-19. Did that come up in the Ashanti region?
That actually did not come up in the meeting that we had with the Ashanti Regional Health Directorate and his other supporters here. But what we do know is that because the treatment centers are full, for instance, a patient over the weekend was turned away from the Kumasi South Hospital after he was referred from the Suntreso Government Hospital. Though the Health Directorate raises concern about the manner in which the patient was transferred from Suntreso to the Kumasi South Hospital. But the underlying fact is that the treatment center was full, and that raises concern and issues about how COVID-19 is being managed in the Ashanti region. So Dr. Tinkorang says that if residents will complement the efforts of Health Directorate by adhering to all the protocols, and also our efforts are being made to expand the treatment center, then the fight on COVID-19 can be won. But the Health Directorate is already overwhelmed because they never anticipate that the figures will rise from 1 to 2,403 cases in Ashanti region. That is something that Dr. Tinkorang admitted.
Thank you very much, Ohiming Teria, for joining us this afternoon on Joy News Today.